It's important to realise that once lockdown is relaxed, the SARS-CoV-2 virus is not going anywhere. It will still be present in the community, so it's likely that some form of social distancing will remain, and close monitoring of infection and death rates will be needed to ensure we don't enter a further phase of accelerated infections and deaths. If we look across the world, Hong Kong relaxed their lockdown after a period of strict isolation. Restaurants reopened and people returned to the office. But unfortunately, this resulted in a second wave of infections, and this relaxation was reversed. A similar picture was seen in China. There may be multiple reasons behind the differences, and although a lot of comparisons are being made between countries, we have to accept that the different approach countries are taking to testing for COVID-19, the way deaths are being recorded as COVID-related or not, whether deaths in the community setting are being included in the figures, and what level of deaths governments actually want to report is incredibly variable and not always transparent. Lots of theories abound why some countries appear to be coping better than others, including the point at which lockdown was entered, the use of face masks, the age of the population, the prevalence of underlying health conditions such as obesity, diabetes and high blood pressure, genetics and population density are to name but a few. A clearer picture will emerge only after there has been proper analysis and scrutiny of the data. The Office for National Statistics has information comparing death rates from coronavirus to other causes of death. It noted that for March, coronavirus was the third most common underlying cause of death in the UK after dementia and ischemic heart disease. So if you live alone or away from your family, it's completely understandable if you're finding things tough right now. Loneliness and separation from loved ones can be really difficult and emotional to deal with. At a time like this, when we naturally want to seek comfort from others, it can be harder still to deal with these feelings. Making the most of video calls with your family and friends can help. Try reframing social distancing as physical distancing. Although you can't be together in person, you can still socialise in other virtual ways. And if you live alone, you may find it helpful to look up the details of local community groups or charities who can help you if you need any support or someone to talk to. It's really important to remember as well that getting out to exercise is crucial, and try and build this into your everyday routine. We know this has both physical and mental health benefits. There are huge challenges to the development of a vaccine. Firstly, getting a vaccine that actually works clinically. Secondly, mass production of any vaccine that is created. And thirdly, the logistical challenges of inoculating huge numbers of people around the world. COVID-19 has seen an unprecedented speed from virus discovery to the beginning of clinical trials. The average time for vaccine development is around 10 years. A recent example of an accelerated vaccine development process is the 5-year timescale for an Ebola vaccine. Researchers are estimating a potential vaccine for COVID-19 within a 12 to 18 month period.